Hi all, you're listening to Discover Your OT Path. My name is Riley Heiser and I'm a student at IU Kokomo. I'm currently enrolled in the Occupational Therapy Assistant Program. For my capstone project, I'm creating a podcast to help current students learn about the various settings available to them. Today's setting that we're going to focus on is Outpatient Peds. So without further ado, please welcome Jera Gentile, who is a licensed COTA.
Hi, Riley.
Hi.
How are you?
I'm good. How are you?
Good.
All right. So before we dive on in, can you tell us a little bit about yourself?
Sure. Like you said, I'm a licensed COTA. I have been one since 2009, so about 16 years. I'm not originally from Indiana. I'm actually from the East Coast, so I went to school in Delaware, where I got an associate's degree. So the school I went to is similar to like Ivy Tech. It's the local community college. I've been a COTA, like I said, for about 16 years. I have been in a variety of settings. I started out with adults and geriatrics in like skilled nursing and transitional care. I've done a little bit of home health. Did a very short stint of like aquatic therapy. I'm not a strong enough swimmer to maintain that. But now I am in the outpatient pediatric setting, and I've been at that facility for about 3 years now.
And what workplace is it called?
So it's, I don't know the actual technical name. It's IU Pediatric Rehab. It's outpatient for Ball Memorial Hospital.
Nice. So
yeah, I guess I need to look that up. I don't know what the actual title is.
Oh yeah, because it's connected to the Riley Peds, right?
Yes and no. So we're both IU Health, but we're not actually the same. But the actual location is with the Riley physicians, the pediatric physicians.
Oh, okay. So speaking about your workplace, how would you describe your workplace?
It's different. I started with that company literally as they were getting ready to transition from one building to another. So I don't know what their other setups and layouts have been. But with this one, it has just basically, as soon as you walk into the room, it is a giant play place. It's a big gym, a huge closet full of toys, some separate rooms for feeding therapy, for, tabletop speech therapy, OT, PT. We have a couple of sensory rooms. And what that means basically is if someone needs to be in there to kind of keep themselves safe, it is padded walls and padded floors just so they don't hurt themselves. And that's where we see our kids. We do have kind of an office space downstairs and in the basement. We like to lovingly refer to it as the dungeon. You don't see the light of day there, but that's where we, if we don't have kids to see, we're down in the basement and doing our paperwork or whatever. We've recently gotten approval to use the very top floor of the facility, and that's still kind of a question mark as to what we're going to use that for. So we're growing for sure, and we also are looking at doing an outdoor therapy area. So essentially it's a playground, but it'll be enclosed in all therapy-based activities.
Oh, that sounds really cool, actually. I think you had mentioned that PT, you work with physical therapists. Are there any other professions that you work with?
Yeah, so we are PT, OT, speech, and feeding. So there's actually a large part of the staff there is speech and or feeding, which obviously to be a feeding therapist, you have to first be a speech therapist. So we are actually very heavy in that because we are right across the street from the hospital. We have some of our therapists that go over into the NICU, some PTs, We have PT over there and OT over there, and then several of the speech and feeding therapists that are over in the hospital with the neonatal intensive care unit. So yes, there's a whole bunch of us.
Yeah. And would you say that you feel like you work around others all day, or with outpatient, do you feel like it's based off if there's any call-offs or who shows up?
As far as staff, I guess I'm not sure your question.
More for like the clients.
Oh, I mean, it definitely ebbs and flows. Holidays are always a big question mark. The weather this past week has been really a big question mark in regards to the cold and when schools are closed and things like that. But yeah, I mean, for the most part, we are scheduled. We have a set schedule, and that varies for everybody depending on their needs staff-wise. But within our schedule, it's typically full. Like from the time you start to the time you leave, you are usually scheduled pretty much back to back, and our sessions are 40 minutes long. So there are the down days where you have to figure out what else there is to do, and there's always plenty to do, but like when your kids call off and cancel, and things like that.
All right. And then just going back to you working with like speech therapists, feeding therapists, and PTs, what do you feel like your energy is like whenever you're working with the other professions?
I mean, mostly good. Some of them make me really think about the things that I do, and how I can change or improve those things. And then some of it is just really helpful to be able to, because we all try really hard to collaborate with the other disciplines if someone's seeing more than one, but it's really helpful to have them right there while you're like if in a co-treat type situation, so you can collaborate on the spot of the things that you're seeing. So I mean, I think it's for the most part pretty harmonious.
That's good. As an OTA, you're like supervised by an OT as like your coworker. So how exactly would you like describe that relationship?
I work very closely with my OTs. So since I've been there, we've dwindled down our numbers, just through retirements and people having babies and things like that. But I've had, multiple OTs supervise me, and what that entails for me, and I guess possibly for Indiana and this setting, I'm a little unclear on which is which, but for me, what that means as far as their supervision is that they sign off on my documentation. So they'll do the evaluations. I will, treat according to their plan of care, but then since I'm the one that's primarily seeing the patients, I'll be able to make changes and things like that, and I just have to discuss with them. So we have a pretty good working relationship where I can just ask a question or say, hey, I want to make this change, and they'll take the time to look it up and talk to me about it if they have questions about it, or if they're like, oh yeah, I know what you're talking about, and then they'll just sign off on it or help me word it properly, because I don't quite have the verbiage down that insurance likes to see. But yeah, it's a good close relationship where I trust them and they trust me to do and write the correct and appropriate things. So
Well, that's good.
Yeah.
Hi guys, we're going to take a little break from the interview and I'm going to ask an NBCOT question. A client is 2 days post-right total hip arthroplasty posterior approach. During a transfer from bed to chair, the client begins to lean forward to reach for the armrest while keeping both feet flat on the floor. What is the most appropriate action by the OT? A. Allow the client to continue because both feet are flat. B. Instruct the client to flex the hip further to stand safely. C. Cue the client to extend the surgical leg slightly forward before they stand. Or D. Place a pillow between the client's knees during the transfer. And The correct answer is C. Cue the client to extend the surgical legs slightly forward before standing. The reason why A isn't correct is because leaning forward may exceed their 90-degree precaution. B, it increases risk. And D, it is useful in bed whenever you're trying to roll over and sit up, but it's not the priority during sit to stand. Let me know in the comments if you got it right. And now we'll get back to the interview.
Probably utilization of space, and that kind of maybe feeds into that question about the energy between coworkers, because like I said, there are a lot of us, and we try really hard to make sure that we're aware of, what patient someone has and what their need for a certain space is. So, if you have someone that needs to be in that blue room, that I'm not taking it up just because there happens to be a swing in there or something, or because I forgot that you had someone in there. So I think it's the utilization of space and a little bit of communication in that aspect as well.
So on those tough days, is there anything that makes it easier for you? Or it sounds like communication is just a really big thing.
I think communication is a big thing everywhere. Like I said, I've been in a lot of different settings, and I think that's kind of something in every setting. But things that make it the day or the situation easier.
I guess you could go into both.
Having a good team that we work with is really very helpful. Like, people that get along and can kind of lighten the mood and joke with each other makes just the day easier in general. And then that communication aspect of it, and people being flexible is really helpful too, because if you find yourself in a situation where someone's in the space that you needed, and for the most part everybody is willing to be like, no, I can absolutely get up and leave this space if you really need this. Like, if you have someone that is got to be in a padded room, which sounds a little silly, but you've been there with me,
yes.
So you understand. But if you have someone that really needs that space, then other people being flexible to find somewhere else is very helpful. So flexibility is important too.
Yeah. Now on the opposite end of that, what do you think is your favorite part about working in this setting?
I mean the kids. Yeah, just the kids in general. There are some of them you pick up some little quirks and things like that just from some of the kiddos, and it's just fun.
I can imagine they'd have all different personalities.
Yes. And some of them really show their personality too.
Yes, they do. What is something that people on the outside, or students who haven't yet got to do a field work at this place, might not expect when working in this profession?
I think I don't know. I think that it's a little unexpected when you see the wide variety of diagnoses that we have and that we deal with. Because sometimes I think, as an outsider looking in, if you have someone who is, nonverbal and not mobile coming in for therapy, but then you see someone who, is walking and talking, and seems quite articulate and things like that, you try to make the connection as to why each of those is in this same spot. So I think that that's a hard thing to try and kind of understand, and it's not off-putting, it's just different.
Yeah.
Because we just have such a wide variety of patients that we see.
That makes sense. For any students or any listeners who might be considering a similar career or work environment, what kind of person do you think thrives there? Could you give me 3 traits that you think would really be beneficial for somebody to fit in there?
Well, like I said, I think being flexible, but I feel that about therapy in general. I think that what we do, it just requires a great amount of flexibility. I think being, I don't want to say a good listener, but I think being a good listener, so you're like listening to your coworkers and understanding where they're coming from. And I don't know, I think I'm not like a super bubbly personality, but I think you definitely have to have like the right personality to click with the kids. And that, for some kids that's one way, some kids it's another way, but it's just, you have to, I don't know, and you have to be willing to just sort of roll with it, because, if you are very rigid and you're not that flexible person, this is not going to be the place for you. And we, like I said, we like to have a good time and have fun. So also, if you're very, I don't know, maybe a really quiet person, it's going to take you a long time to probably warm up to, in our place specifically.
Yeah.
It's probably hard to warm up to our staff, because we're a little, I don't know, like I said, we like to have fun. So
yeah.
And we've gotten used to each other. I mean, I don't know, everybody's been there longer than me for the most part, but I've been there for 3 years, and in that 3 years, I think we've built some really good bonds, in the clinic and outside, and I think that has been super helpful.
Yeah. Before we finish up here today, is there anything else you'd like to share about your work setting, or just an experience you've had that you think that others should know?
I guess I'm going to backtrack a little bit, so I apologize. In my particular setting, I also have the opportunity to go into schools 1 day a week.
Mm-hmm.
And that's kind of a nice little break from being around the chaos and the people. So there's nothing particularly about, I guess, the pediatric setting, but ask questions. If given the opportunity, then make sure that you try to like shadow, or what we do a lot of times when new people come in to interview is, before we actually sit down to do the interview, they'll get a tour, and then they'll have the opportunity to shadow the discipline that they're hiring for, but also sort of look around the clinic and see how the other kids act and how the other staff act and things like that. So I think that, asking for the opportunity to observe or shadow is helpful, because you really have no idea what you're getting into until you get there.
Yeah. All right, well, thank you so much, Jera, for letting us know all about working in your outpatient pediatric setting. We really appreciate you being here. And then thank you for everybody for listening. Be sure to follow along for the next episode, where we'll be diving into working at a school.